My name is Tabitha Mounteer. I'm a nursing student at the University of South Alabama, and today I'm going to be performing a urinary indwelling catheter insertion. So first, let me show you my ID. And I'm going to scan my room. So the first thing that I'm going to do whenever I walk into my patient's room is verify my orders using the patient's record and also verify my hospital's policy. Next, I'm going to verify the correct patient using two identifiers. So this patient's name is Jaguar Jones and the patient's date of birth is 08/25/1963. I'm also going to evaluate the indications for indwelling catheter per the nursery protocol. So those are things like required immobilization for surgery, trauma, or other therapies. So next I'm going to explain the procedure to my patient and perform hand hygiene. Next I'm going to gather all of my equipment. I'm going to don my goggles. And I'm going to perform hand hygiene again. I'm going to position my trash can first and then perform hand hygiene. So the next thing that I'm going to do is I'm going to raise the bed to a comfortable working height, lower my side rail, and then position my patient in dorsal recumbent with their legs slightly bent. So the next thing that I would do would be to don clean gloves, and then I would perform perineal care using soap and water. So for a female, you wash from front to back, and each time you make a swipe, you use a different portion of the rag as not to contaminate the already clean portion. And for a male, you go around the glans penis with a clean portion each time. So the next thing I'm going to do is I'm going to open my catheter kit, place it between my patient's legs. I'm going to position this bag to be used as a trash can. So the next thing that I would do would be to perform hand hygiene, and then I'm going to open this kit using sterile technique, only touching the outside of the drape or the 1-inch border around the drape, so not to contaminate. Next, I'm going to don sterile gloves. And then I'm going to lay this drape in between my patient's legs with the shiny side facing downward. And then I'll scoot it closer to my patient. And then I'm going to move this tray closer to my patient. Next, I would pour the betadine onto my cotton swabs, and then I would take my lubricant and just place some in this tray here, and then I would uncap my water-filled syringe and to remove the plastic on my urinary catheter, and I'm going to place the catheter into my loop. So for females, you would lubricate 1 to 2 inches, and for males, you lubricate 5 to 7 inches. So next, with my non-dominant hand, I'm going to spread the genitalia, and then I'm going to clean with my cotton swabs from least contaminated to most contaminated. And then once this is done, I cannot let go of the genitalia and allow them to close, or they will become contaminated. So then I will take my catheter, it has been lubricated 1 to 2 inches for a female, and I will insert it into the urethra until I meet urine, and then advance 1 to 2 more inches after urine is met, and then I'll hold this in place and inflate the balloon. When inflating the balloon, you hold continuous pressure on the plunger until it is removed, so that the balloon does not deflate and move in the urethra. So I've removed the syringe, the balloon is in place. For males, if I was inserting this into a male, I would insert it all the way to the bifurcation for a male. So the next thing I'm going to do is I'm going to get my stat lock, and I'm going to place my catheter inside of my stat lock, and then I would prepare the patient's skin according to the directions on the stat lock, and attach the stat lock to the patient's thigh without holding pressure on the catheter, so that the urethra is not damaged. So this can be taken off if needed, but for now I'm going to leave it inside of the stat lock. And then next I would take the drainage bag and I would attach it to the side of the bed without any dependent loops, so that the urine could flow freely to the urinary drainage bag. And I just touched my face, so that would be a break in sterility. So the next thing that I would do would be to I could collect a sterile urinary specimen after just inserting the catheter. So I would take a drape and the trash can. I'm going to lay a drape on the ground. I would take a graduated cylinder and place under the bag, and then I would take my specimen cup, remove the cap with the cap facing up, place it on the bedside table, and I could take a specimen from this port here into my sterile container. I would just release the clamp, allow it to flow into my sterile container, and then replace the clamp, just allowing the clamp not to touch the inside of my container. And then I would just replace that back into its place in the bag. I would recap the specimen and then label the cup instead of the lid, and then send it to the lab. You may need to take a specimen from a catheter that has been inserted for maybe a few hours or sometimes maybe in a few days. So if you need to do that, you'll have to take this clamp and clamp off the tubing. And then whenever you do that, you'll allow urine to collect in the drain tubing right here. And then you can take an alcohol pad and clean the port. And then you would take a syringe and just insert it into the port and withdraw urine. And then after you have it withdrawn, you just remove it from the port. And then you would already have this specimen cup open, because you would not have just taken another sterile specimen, but you would just insert it into the cup, making sure that the syringe does not touch the inside of the cup. Discard of that, and then you recap and label it and send it to the lab. And then you always have to make sure that you unclamp the tubing so that the urine can flow freely after you have taken a sample from the port. So whenever it is time to remove so after I had done that, I would go and document. So I would document the type, the amount, the color, the consistency, the odor of the urine, the amount that was in the drainage bag. I would document the type and the size of the catheter that was inserted. I document whether a specimen was taken from the catheter or not, and then I would have to perform routine perineal care and documenting routinely the amount of urine output. So then to just continue a urinary catheter, first you will have to empty the urine bag, which is the same as you do for taking a specimen. So you just unclamp it and allow it all to drain into the graduated cylinder. Then you can reclamp it and insert it. And then after that, you will remove this from the stat lock, and I threw my syringe away. It's the only one I had. But normally you would use a clean, new, sterile syringe, but I do not have another one, so I have to reuse this one. But first you're going to loosen the plunger on your syringe, and then you're going to draw back to about half a milliliter, and then you just insert it onto the balloon pump and allow the balloon to be emptied by gravity. So once the balloon is completely empty, then you can remove the catheter, and then you would just throw this away, and you would also clean up all of your other supplies and throw all of this away as well. And that completes a urinary catheter insertion and also removal.